Hi, everyone. I'm Tatsuya Kin. Today, we will explore the basic anatomy of the pancreas in relation to the duodenum. We will focus specifically on the spatial relationship between the ventral and dorsal duct openings. Here, the body is in the prone position, and we are looking from the patient's right side. This is a simplified schematic of the second portion of the duodenum. This way is distal. This is posterior side. Here is the opening of the dorsal pancreatic duct. Where do you think the opening of the ventral duct is located? Right here. The ventral duct opens at this point. It is located distal and posterior to the dorsal duct opening. Distal and posterior. Keep that in mind. Now, let's look at the duodenum from a different angle. Do you see the relationship? This figure shows the posterior aspect of the pancreatic head. When we cut the pancreas head along this line, and we view the cut surface from this way, we will find the cut surface like this. This side represents the posterior surface of the pancreatic head. Here is the bile duct. I bring back this duodenum figure here. You will find the ventral duct here and dorsal duct here. Clear so far? Here is a normal pancreas. You do not see the bile duct because it has already been removed. I have inserted a catheter into the ventral duct opening. You can see the fluid fountain here. This is the dorsal duct opening. This is a case of pancreas divisum. The anterior surface is oriented downward. I have inserted 16-gauge catheters into both the ventral and dorsal ducts. To demonstrate the location of the bile duct, I have inserted forceps into it. Can you tell which 16-gauge catheter is for the ventral duct? Yes, this one adjacent to the bile duct is the ventral duct. Now I will cut the pancreas. Because this is a case of pancreas divisum, you may notice two important findings. First, the dorsal duct is larger than the ventral duct. Second, the ventral duct runs very close to the posterior surface of the pancreas. And the ventral duct is so tiny. Here is another case of normal pancreas. Notice that the ventral duct is located posterior and distal to the dorsal duct, whereas the dorsal duct is located anterior and proximal to the ventral duct. Understanding this spatial relationship between the ventral and dorsal ducts is critically important for islet surgeons. I will continue exploring the embryology and anatomy of the pancreas. Thank you for watching.